Did you know that your newborn might actually lose weight? Stay tuned and find out more. Hi everyone, my name is Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. I want you to know, as a parent and as a pediatrician who's gone through this a few times, seeing your newborn lose weight, even though you know it's expected, can be a little alarming, and you're wondering, am I doing something wrong? Well, here's the thing. As pediatricians, we expect somewhere up to 10% of weight loss from your newborn, and that can be due to a number of reasons. The best way I describe this to families, not only in my office but even in the nursery, is there are fluid shifts happening in the first few days to hours, right? Your baby is going from an environment where it's a controlled environment, they're surrounded by amniotic fluid, and now they're being exposed to the outside air, and they are peeing, pooping, trying to take in their own nutrients. The umbilical cord's not doing that work for them anymore. The amniotic fluid is not around them anymore. It's not that controlled environment where the temperature is regulated. So environmental factors, fluid shifts, we do expect some degree of weight loss. Now, typically, babies do regain this lost birth weight by 10 to 14 days of life. That's why we usually see you 3 to 5 days after being in the hospital, and then we see you again usually by 7 to 10 days, sometimes up to 14 days later. And what we're doing is really trending and making sure feeding's going well, that your baby has regained birth weight. There's certain situations where we know that definitely the baby might be more likely to not regain their birth weight as quickly. That could be, for example, if you're a first-time parent, so milk can be a little slower to come in. We definitely know that those parents can sometimes struggle as well with nursing because it is very difficult and a very sharp learning curve. We also know that children who are born vaginally seem to regain their birth weight a little bit faster, and that could be simply because C-section recovery can be very difficult, and perhaps the milk is again slower to come in, or that mother is not feeling as well and not able to place baby at breast. So there's many different factors at play here, but nonetheless, I have seen C-section babies who have definitely lost more than 10% of birth weight, and I have seen vaginally born babies that have definitely lost less than 10% birth weight. I have seen babies who are baby number 2 and 3 to a parent and have lost more than 10% birth weight, and babies who are born to first-time parents who are able to regain their birth weight beautifully. So there's definitely trends that we are aware of and things that we consider when looking at baby's birth weight and the degree of weight loss. But generally, just to understand that we look at each baby individually as well as pediatricians, and I think that's really, really important to understand. So during the first few days of life, there are some signs to indicate babies losing weight and how much is allowed and adequate and understood and accounted for and what's not. One thing I describe to parents is on day 1 of life, you should see 1 wet diaper, and day 2 of life, you should see 2 wet diapers, day 3 of life, 3 wet diapers, and following that pattern until about day 5. And by day 5, you should be starting to see lots of wet diapers, at least 5. Day 6, 7, just keeps going on, right? You should see at least 5 wet diapers from day 5 onward. And that is a good indication that baby is getting enough to drink, whether that be formula or breast milk. So risk factors that might indicate that baby is having excessive weight loss is less than 1 void or 1 wet diaper a day, less than 1 stool a day, because again, stooling is the way that the baby gets rid of jaundice in the body, and we've done videos in the past on what is jaundice. I will definitely link that here. I highly recommend you check it out because it does explain why your pediatrician is so obsessed with how much your baby is pooping and the color of their poops. Other indications that your pediatrician might pick up on is red-tinged urine. This is actually urate crystals in the diaper, showing that the urine is very concentrated. We might even see that the lips look a little dry, and your pediatrician might pick up on small skin findings in your newborn infant that indicate that your baby is dehydrated or not getting enough fluids in, whether that be formula or breast milk. So in certain settings, your pediatrician may indicate that supplemental feeds are necessary or even triple feeds. This is an example like excessive newborn weight loss, where we would recommend triple feeding if you're nursing or supplemental feeding. And that's feeding after whatever baby may have nursed or taken in at their regularly scheduled time. Now, there's varying amounts that your pediatrician may recommend for whatever reasons based off of the child's age, what the baby's able to tolerate, or what they're already taking in. Now, another important factor to consider is pacifier use. So I'm a big fan of pacifiers because they can have a decreased risk of SIDS, but I'm very, very cognizant of when I recommend introducing them. So the first 2 to 4 weeks of life, you want to try to lay off of introducing a pacifier, simply because if your baby is showing feeding cues and rooting, then we should definitely honor that and bring baby to breast or allow baby to feed at the bottle, because that allows them to appropriately honor their hunger requests and be able to feed and avoid that excessive weight loss. However, if we're providing a pacifier that does pacify the rooting reflex and then stretch you out for another feed perhaps, but at this time we're really trying to get the newborn to regain birth weight. And if you are nursing, pacifier use early on can actually interfere with really the latching relationship, because we want to bring baby to breast anytime baby is showing signs of rooting, especially in those first 2 to 3 weeks. All right, I hope this video was helpful, especially discussing why newborns lose weight. I know it can be very alarming for some parents, but finding out really the physiology and the reasoning behind it, I always found that very, very fascinating, and one of my favorite things when talking about newborns and just newborn life at home with parents, whether I be in the nursery or in the office. If you have any questions about newborn weight loss, please feel free to drop them below. But remember, there's no personal medical advice here. This is definitely just for education. I hope to see you guys again next week. Bye.